Today I will be talking about the top 5 mistakes which new parents are commonly making. These things I've observed in my practice and I feel that they adversely affect the child's health as well. Number 1, not giving breastfeeding 100%. Breast milk is the perfect thing for your child, and the initial few days may be a bit of a struggle, but once the baby learns to latch, you know how to feed the baby, life will be much easier for the first 1 year. Less infections, less colic, no hassle of sterilizing bottles, buying formula, it's much cheaper. But what happens, new parents have so much self-doubt and the constant advice from friends, families, peers, and constantly reading on the internet that baby is crying, you should give formula milk. If you don't start bottle milk early, baby will never take formula milk, and baby is not as fat as the neighbor's baby, so we need to feed more. All these things lead to early initiation of formula feeding, and slowly the breastfeeding goes down. So please avoid this major mistake. Number 2, what I'm observing is early introduction of screen time. Like an year back, I hardly saw a baby less than 1 year being exposed to screen. Now I find at vaccination visits, 6 months babies, 9 months babies, when they're crying, the parents are showing them the screen. It's okay if the baby cries. It's good for the babies to cry. You don't have to be so worried, but new parents have so much anxiety and they just want to pacify the baby immediately. Screen time is a one-way street. Once you start, it will keep on increasing. It will not decrease. The child will get addicted to it. So by the time the baby is 1 year, if it is 1 hour, by the time the baby is 2 years, it will be 3 hours. By the time the baby is 3 years, it will be 4 to 5 hours. And it is very detrimental for the baby's physical, mental, psychological, and social well-being. So please do not get tempted and start screen time early. Number 3, the fascination with biscuits. I find it astonishing. Out of every 3 parents, at least 2 will ask me at the age of 6 months, 9 months, when can I give biscuits? What biscuits can I give? Biscuits are nothing but maida, and why this fascination I fail to understand. Biscuits are not an important part of your child's diet. Even if your child never has biscuits, it's perfectly fine. They are maida, they are sweet, and children love to eat them. And all these things which rate whole atta biscuits, this biscuit, that biscuit, trust me, the commercially available ones have maida or refined wheat flour, which is not at all good for your child's health. And these are the things that are addictive, and the child will prefer to eat more and more biscuits. Similarly, other junk food, introduction of junk food earlier, like your chips, chocolates. But what I find the most common culprit is biscuits. It's just take it out of your mind. Biscuits are not required. Number 4 is medication, self-medication, medication, listening to a neighbor, listening to a friend. I have parents giving the child absolutely wrong dosages of medicine, sometimes high, sometimes low, sometimes improper antibiotics, and then they will defend themselves saying that my relative is a surgeon. A surgeon can do surgery. He is not used to the weight of a child. See, pediatric doses are weight-based, child-based. So please do not do this mistake of medicating the child. Some of these medicines can have severe complications. If you give antibiotic in inadequate dose just because your neighbor's child responded to an antibiotic, or if you give unnecessary antibiotic, there will be a time when your child will not respond to antibiotics. So please, no self-medication, no medication from listening to advice of relatives, peers, or some doctor of a different field. If somebody asks me a medicine for depression, I'm not going to prescribe that. I'm a pediatrician. So similarly, other doctors cannot prescribe medicines for a child. And number 5, the pressure from the internet, from the social media, the peer pressure. I feel parents really feel it these days. Mothers will be doubting themselves so much, more than fathers, I feel, if it affects the mothers. And they are always doubting themselves, seeing these wonderful, perfect kids on social media. And then, they are doing great, they're feeding the child well, and then they will see a lot of fancy things that these mothers are doing, and then they'll try to copy that. And that just increases the pressure on parenting. As it is, parenting is so difficult. So all the new parents out there, please avoid these top 5 common mistakes, and happy parenting to you.